We're back. You're listening to Dialogue with Dinkins. I'm Dave Dinkins. We're taping this show on Thursday, the 27th of June. You're hearing it on Saturday, June 29th. So therefore, you cannot call in. I know you'd like to call in and talk to these two really civic-minded, good people, but you can't. We were talking just before the break about the difficulty that some have in not having a physician who accepts insurance. Now, we know, you two know, I'm sure, that it costs government a whole lot less if we provide preventive care. And the example I used to cite is the woman who is pregnant, and she doesn't go to her family doctor. She goes to the emergency room, which is pretty expensive.
Exactly. That's the most expensive place to get care.
But that's what she does. And so now she goes to the emergency room, and she waits 3 hours, 4 hours, 5 hours, 6 hours, even at some of our, quote, best hospitals. So the next time, and she's supposed to come back, routine checkup, she says, I'm not going because I'm not going to sit around and wait all that time. I have to work or I have children to take care of, other children at home. Mm-hmm. And I've had children before, so I don't really need all that help. But this time, there's a problem. So the child is born maybe low birth weight, has to remain in the hospital for an extended stay, and the taxpayers are paying for that. All because she didn't get the requisite care sufficiently early. So we know that. We, society, we're aware of this. Right. But yet we don't do as we might do. So I'm hoping that Obamacare will fix it so that that pregnant woman can go to a physician of her choice, mm-hmm. and be treated and not be ultimately in a circumstance wherein she's faced with an emergency room doctor. Yeah. Emergency rooms are no fun anyway, I might tell you. I've been to a few.
The shift that's happening is the reimbursement today is based on volume. So the more a doctor does, the more they get paid. Mm-hmm. And Obamacare hopes to shift it to more of quality-based. So it's not how many surgeries did the doctor do, it's what was the outcome of the one surgery? Are they better off than they were before? And the reimbursement to the doctor is higher for the higher quality versus they're just, doing them in volume. So, for example, for this ER piece, the federal government, when they reimburse the hospital, will look at that ER and say that's an avoidable ER, emergency room piece. So we're not going to spend the same amount of money we used to because it should have been better routed through an urgent care facility or through a provider's office. And even if you walk around New York City, you'll see more urgent care facilities popping up. And these are places that they can handle those type of issues. I have a fever, my baby has a cold or an earache. You go there first rather than waiting in the waiting room at an emergency room. And more of these are popping up because the healthcare reform bill puts more money to those places for those type of services than it does to the hospital.
Does this legislation provide assistance for those who wish to go to medical school and who then give back by service to so-called underserved communities?
Exactly, yes. So one of the workshops we had was from HHS. There was a deputy director from HHS that spoke about this program.
Health and Human Services.
Yes. And so physicians that go to medical school and they have loans, and sometimes people don't pay these loans off until they're 40 after they get out, another 10 years. If they choose underserved communities to put their practices and stay there for 5 years, the federal government has over $1 billion to offset those loans, and they pay them off on behalf of those physicians.
That's very, very important. That's terrific. I know that Erwin Redlener, who is one of the founders of the Children's Health Fund, He, along with Paul Simon, the singer, not the United States Senator, but they founded the Children's Health Fund, and Irwin is terrific at explaining access to health care means a variety of things. I mean, one can have a physician who's available, but the physician is way over there, and it maybe is 10 miles away, and the road between the physician and the patient is not paved, it's muddy in rural America.
Right.
Or it could be that the patient who requires care of a physician lives in an area where there are very few physicians, maybe one per X thousand as opposed to one for a far smaller number. Now, if one happens in New York City, if one happens to live in an area where there are a lot of physicians, it's an entirely different circumstance than one who lives in what some would call the ghetto, and there are fewer physicians.
Exactly.
And so access can mean a lot of things.
One of the pieces, too, so the other issue for African Americans in getting these screenings is finding a doctor that looks like themselves. They feel more comfortable, say, a black doctor doing services, talking to them, understanding their body, and things like that. And the good news about this program that offsets the loans that doctors have after med school is there's a higher proportion of minority doctors in those programs. So minority doctors today is probably 3% of the doctors, that exists today. But in that program, it's a much higher percentage. 10, 15% are minority doctors taking advantage of these programs.
Well, when I went to school long time ago, there were maybe 95% or more of the black physicians were trained at either Howard University or Meharry because they couldn't get into other schools. There are few, but damn few. Today, of course, thank God, it's a lot better than it was then. But it's still very expensive to go to med school.
Exactly.
So the program of which you just spoke is tremendously important. Well, how did you guys get this interest in wellness and all, and what directed you to 100 Black Men? I mean, you're already in 100 Black Men, but what made you do this aspect of things?
Well, for me, my background being in human resources, a piece of that was dealing with benefits issues. And I actually, a few years back in 2008, 2009, chaired the Health and Wellness Committee then. And I just became, extremely interested in it. I see the need. We would do all types of community outreach, some of it in the various projects to have tenant association meetings to try to encourage the residents to get screened and just provide more knowledge in general about various healthcare issues. And I just, being in that role, I just became, the more I did it, the more and more I sort of got excited about it, the more I got interested in it, and it's a really big need in our community.
No, good for you. It's terrific.
Yep. And so my father, immigrant from Haiti, came to America and somehow got a job washing dishes and had $11.99 union coverage. And so that was the way I got
Martin Luther King's favorite union.
And that was our way to get health care, was $11.99. And I thought $11.99 was a health insurance company because the card would say $11.99. And we didn't have dental coverage. And so I spent 18 years on his insurance, never went to the dentist because we just didn't have the money. And finally, when I got my first job at Empire Blue Cross Blue Shield, and I got their insurance, and I got dental, and I went to the dentist, they said, "What happened to your teeth?" And that's sort of where my passion started, because it shouldn't be that way.
I have a buddy of mine, the brother of Bill Haling, the physician, who was the first national president of 100 Black Men, a comes initially out of Trenton, New Jersey, was living in Newark, and it was he who was insistent on the 100 Black Men having chapters and going nationwide, as we ultimately did, and it's all for the better. Well, he has a brother who is a dentist, Leslie Hayling, Hayling, and so he's been my dentist forever. And so one day I had some discomfort, and I went to, I'm living in New York now, living in the Riverton, and having trouble paying that rent. And I was in law school during the day and working in a liquor store at night. And so I had this discomfort, and I got in my little raggedy car and drove to Trenton. And so I got there, 5 or 6 o'clock in the morning, and I called him when I got nearby, and he said, "Come on in." And so I get in, and he's whistling, and he's a very funny fellow. He's whistling and doo-doo-doo-doo-doo, and taking 1,000 x-rays. And then he comes and he says, "Well, your teeth are all right, but your gums have to come out." He's a Tuskegee Airman, I might add. Yeah. He's a funny fella. I used to enjoy. These guys have to recite all kinds of things, and the one I remember the most is the thing that you're supposed to say to indicate that you have had enough to eat, and it goes, "My gastronomical satiety admonishes me that I have reached that high state of deglutition, which is highly consistent with my every dietetic integrity." But they got 1,000,000 of those. And I used to sit and marvel at because we were at Howard together, and we were living in the same place. But he said, "Your teeth's all right, but your gums have to come out." But his brother, William Hartley Hayling, Bill Hayling, delivered